At this point, the nation is living with COVID-19, but right now it's looking like there's not enough money to ramp up the country's response when cases start to increase as the colder months arrive.
For a while it was, you're going to get your flu vaccine and your COVID vaccine. Right now, that does not seem to be the case.
Unless Congress comes together to figure out how to fund this, it's our understanding that there would not be enough funds to purchase vaccines for all eligible entities.
Lacey Fehrenbach is a deputy secretary for the Washington State Department of Health. We asked her, if there aren't enough vaccines, what impact will that have on the state's pandemic response?
If we're going to pull back our ability to use all of those tools, we're going to find ourselves in a really, really challenging situation.
The White House has said multiple times this week the U.S. is at risk of losing its place in line to purchase new treatments and vaccines. It likely means come fall, vaccines will only be available for those who are high risk.
It is deeply troubling that we are looking at a third very challenging winter. And we have not learned the lessons of the past.
Fehrenbach says the pandemic isn't over, but there are now tools to live with COVID-19, like at-home tests and masks. So we asked how she would describe the current state of the pandemic in Washington.
There are still risks out there, and we are seeing increasing disease in Washington state. The hospitalization rate is actually still below where we were at the low point between the Delta and Omicron waves.
So what should people consider when determining their risk?
People will have to think about their own health status, the health status of people in their household or people that they're frequently with. Do you know the vaccination status of people where you are? What is the air quality? So outside is safer than indoors. And then when you're indoors, have you maximized your ventilation?
So Dr. Duchin, who heads the COVID response for Seattle and King County Public Health, we spoke to him, and what he said is that what's happening at the federal level, he called it pathetic and unacceptable for a wealthy nation like the United States. Now, the FDA is scheduled to meet on June 28th to discuss its fall vaccination campaign. That's going to be dependent on vaccine funding.